When one thinks of underserved communities in Los Angeles, one does not think of Malibu. But according to LA County Department of Public Health numbers, the beachside enclave's COVID-19 vaccination rate ranks right between those of Montebello and Pico Rivera. What's more, Malibu's 31.4% vaccination rate is nowhere near those in areas of comparable affluence, such as Palos Verdes Estates, 43%, Bel-Air, 46.7%, Beverly Hills, 45.5%, and Brentwood, 43.9%. Even the much larger and more diverse Santa Monica clocks in at 37.5% vaccinated. So while state and county health officials have worked diligently to vaccinate underserved communities and those in the region's lowest economic quartile, one of the county's most affluent locales has also lagged behind. Asked about those discrepancies last week, El County's Chief Science Officer Dr. Paul Simon said, "Malibu is one example that surprised me a bit. Generally areas with higher average income levels have higher vaccination rates," according to Simon. He shared a map, shown above, that proved his point. The map shows vaccination rates as shades of green, lighter for a lower rate and darker for a higher rate. While nearly all of West L is the darkest shade of green, a vast swath of Malibu stretches to the left of the map in much lighter tone. Another map he shared shows the discrepancy also holds true among Malibu's seniors. Malibu, of course, has a history of vaccine hesitancy. That could be some of what's at play here. In 2014, an L Times analysis of data revealed that, while personal belief exemptions for vaccination of kindergartners in L Unified ran at just 1.4%, in the Santa Monica-Malibu district the overall exemption rate was 10 times greater, at 14.8%. Personal belief exemptions were eliminated in 2016, after which medical exemptions for vaccination spiked in Santa Monica-Malibu district kindergartens. According to in January 2020, a new law restricted those, as well. Another factor may be distance. "I have had some conversations with some folks in Malibu," said Dr. Simon. Lower vaccination rates there, he speculated, may reflect some geographic isolation and some vaccine hesitancy among families with children. While there was a one-day clinic for residents on Thursday at Pepperdine and another scheduled for City Hall on the 13th, there are fewer regular opportunities to get vaccinated in Malibu. The local CVS is administering shots and Malibu Urgent Care provides them, but there are no super sites nearby with large numbers of vaccines. In fact, the two clinics mentioned above reportedly had just 500 doses between them which, if they weren't the one-shot Johnson & Johnson variety, would be enough for just 250 people. Asked about factors driving the low vaccination rates, City of Malibu Media Information Officer Matt Myerhoff said he suspects the lack of large vaccination sites within close driving distance that can handle thousands of people per day.